following video is the property of A1 Upgrades. Unauthorized copy and or distribution is not permitted. By continuing to watch this video, you accept those terms. Hi, I'm Barry from A1 Upgrades, and this is Chaco. This video was recorded on April 2nd, 2017. If you haven't viewed the first video in this series, please go to the address on the screen. This video is specific for 2017 and the CMS payment adjustment factor called Advancing Care Information that was formerly called Meaningful Use. The video is specific for A1 Upgrades clients which all have the modified Stage 2 certified version and is specific to the Mips model and not the Advanced Alternative Payment model. So sit back and relax. This video will only take a few minutes. Remember, as we learned in the first video, your payment adjustment factor is broken down into three parts for year 2017, of which 25% is based on ACI. On other videos, we'll review the quality and improvement activities. ACI is broken down into three parts. A base score, which is 50%, a performance score, which could get up to 90%, and a bonus score, which could get up to 15%. Although your total for all three may be more than 100%, there is no additional benefit to get above 100%, but you don't want to be below the 100%. First, let's talk about the base score. The base score for your certified version is made up of 5 measures, and aside from the security risk analysis, which requires a yes answer to qualify, all other measures must have at least one numerator. These are the same as you were doing with Meaningful Use. So you need at least one e-prescribing, one patient who you set up for WebView, one patient who you send a clinical summary to another practice through your direct messaging, and one summary of care you receive from another practice. So with getting all those minimums, you automatically get your 50%. Now we will look at the performance score. These measures each have a performance, including each of the base score measures. This is similar to your Meaningful Use, except your numerator over your denominator gives you your percentage for each measure. Note that I marked an X next to what measures you most likely did last year. So understand each measure will have its own performance. In this example at the bottom, a provider with 100 patients in which 85 were given patient education would get a 9% for that specific measure. This screen compares to what you most likely did last year. In this example, we have 100 patient encounters and 81 of which were electronically prescribed, giving us 9%. Note that some measures will not have the same denominator and be a lower quantity so that it'll be easier to have a higher percentage. In this example, we have reached the 50% performance total, and with the 50% base, we've met the entire 100% and we're done. Now we'll review the bonus score. If you didn't get to the 100% of ACI, you still will get a bonus of 5% if you can connect to a public health or clinical data registry, and 10% if you can implement an improvement activity, which we'll review in its own video. So bottom line, don't create a mess like Chaco did getting into a new box of Q-tips. Continue to do what we put in place and pay attention to your reports. For ACI, you should only have a minor change, if any, compared to last year. The only difficulty is putting together the calculations to make sure you get over the 100% of ACI. Please review your quarterly reports.